Alright, so today we're going to explore the intricate processes of hemostasis and fibrinolysis. These are two critical mechanisms that our bodies use to control bleeding and maintain the delicate balance between clot formation and breakdown. In this video, we'll dive into the steps of hemostasis, the role of fibrinolysis, and the disorders that can arise when these processes go awry. Let's get started. Hemostasis is the body's natural process of stopping blood flow to prevent excessive bleeding when a blood vessel is injured. The term hemostasis comes from hemo, meaning blood, and stasis, meaning to stop. It involves two main stages: primary hemostasis and secondary hemostasis. Primary hemostasis begins almost immediately after a blood vessel is damaged. Platelets, which are small blood cells, are the first responders. They adhere to the exposed collagen fibers at the injury site, becoming activated and changing shape. This activation causes them to release chemical signals that recruit even more platelets to the area, forming a temporary platelet plug. This plug serves as a quick fix to reduce blood loss. Next comes secondary hemostasis, which reinforces the platelet plug with a stronger, more stable structure. This process involves a series of reactions known as the coagulation cascade. During this cascade, various clotting factors, mostly proteins produced by the liver, are activated in a specific sequence. The final outcome is the transformation of fibrinogen, a soluble protein in blood plasma, into fibrin. Fibrin strands weave through the platelet plug, creating a dense mesh that stabilizes the clot and seals the injury. While forming a clot is essential for stopping bleeding, it's equally crucial that the body regulates this process carefully to prevent clots from becoming too large or forming unnecessarily. This is where fibrinolysis comes into play. Fibrinolysis is the process by which the body breaks down and removes the fibrin mesh that stabilizes blood clots. This process ensures that clots are removed once the underlying tissue is repaired, maintaining the fluidity of blood and preventing vessel blockages. The primary enzyme responsible for breaking down fibrin is plasmin. Plasmin is formed from its inactive precursor, plasminogen, which is incorporated into the clot as it forms. Plasminogen is activated to plasmin by enzymes like tissue plasminogen activator, TPA, and urokinase, which are released from the endothelial cells lining the blood vessels in response to various signals, including the presence of a clot. Once activated, plasmin degrades fibrin into smaller fragments known as fibrin degradation products, FDPs, such as D-dimers. Elevated levels of D-dimers in the blood can be a clinical indicator of recent or ongoing fibrinolysis and are often measured to assess clot formation and breakdown in the body. The body must regulate fibrinolysis carefully to ensure it only occurs when necessary and does not lead to excessive breakdown of clots, which could cause unwanted bleeding. Several mechanisms help regulate fibrinolysis. Plasminogen activator inhibitors, PAIs, such as PAI-1, inhibit TPA and urokinase, controlling the activation of plasminogen and thus fibrinolysis. Plasmin inhibitors, like alpha-2 antiplasmin, directly inhibit plasmin activity, ensuring that once plasmin is activated, its action is contained to the area of the clot. Now, let's dive into disorders of fibrinolysis, which occur when there is either too much or too little fibrinolytic activity. One example of a fibrinolytic disorder is hypoplasminogenemia, a rare inherited condition characterized by abnormally low levels of plasminogen. This deficiency leads to reduced formation of plasmin, impairing the body's ability to break down fibrin clots effectively. As a result, fibrin accumulates in various tissues, leading to the formation of thick, wood-like growths known as lineous pseudomembranes. These typically appear on mucous membranes, such as the conjunctiva of the eyes, but can also affect the skin, gastrointestinal tract, and other organs. Hypoplasminogenemia is caused by autosomal recessive mutations in the PLG gene. Patients with this condition often present symptoms in early infancy, and the diagnosis is typically confirmed through clinical presentation, laboratory tests for plasminogen activity, and genetic testing. Treatment often involves the administration of replazine, a plasma-derived human plasminogen, to help restore normal fibrinolytic activity. However, this treatment can have side effects, including gastrointestinal upset and extremity pain, and should be managed carefully to avoid complications like hemorrhage. Other disorders affect fibrinolysis in different ways. For example, some patients might have a deficiency in plasmin inhibitors like alpha 2 antiplasmin, leading to excessive breakdown of clots and an increased risk of bleeding. Conversely, overactivity of PAIs can prevent sufficient clot breakdown, raising the risk of thrombosis, where clots form and persist inappropriately within blood vessels. To manage these conditions, medical professionals might use fibrinolytic therapy, which involves the administration of agents that promote clot breakdown by enhancing plasmin activity. Fibrin-specific agents like TPA and its recombinant forms, such as alteplase, retaplase, and tenecteplase, are commonly used to treat acute conditions like ischemic stroke or myocardial infarction, where rapid clot dissolution is necessary. Non-fibrin-specific agents like streptokinase and uralkinase are also used, although they are less targeted and can cause systemic fibrinolysis, leading to a higher risk of bleeding. However, there are contraindications to fibrinolytic therapy, including active bleeding, a history of intracranial hemorrhage, recent surgery, severe hypertension, and known bleeding disorders. In cases where fibrinolytic therapy leads to adverse effects like excessive bleeding, antifibrinolytics such as tranexamic acid and aminocaproic acid can be used to inhibit fibrinolysis. These agents work by blocking the formation or activity of plasmin, helping to stabilize clots and reduce bleeding. Understanding hemostasis and fibrinolysis is vital for recognizing how the body maintains a balance between clot formation and breakdown. Whether through natural mechanisms or medical intervention, regulating fibrinolysis ensures that the circulatory system remains healthy and free from unwanted clots or excessive bleeding. If you enjoyed this video, please give it a thumbs up, share it with your friends, and subscribe for more insightful content. And if you're using the King of the Curve app or web app, make sure to like and comment on what topics you'd like us to cover next. Check out the app for more detailed content and quizzes to test your knowledge. Thank you for watching, and good luck studying.